I want to welcome you all to the Nurturing Minds and SEGA COVID-19 response webinar. I am Lauda DeDominicis, and I'm the Executive Director of Nurturing Minds. And more than anything, I want to start by thanking you all for joining us today, but also thanking you because if you are on this webinar, you are probably one of our supporters and supporting the holistic education that we provide to our students in the best of times. And so we are especially appreciative that you are supporting us during this crisis and keeping our girls and our mission close to your heart. So before we get started with our panelists who will share different aspects of what's going on in Tanzania, what our response is, and a little bit about the bigger picture of risks to adolescent girls in a crisis, I want to start with a little bit of housekeeping. I want to let you know that this webinar is being recorded, so we will be able to share it with others in the future. Also that you are all muted right now, but that you'll see at the bottom of your screen, there's a Q&A button. And we do encourage you to type in questions into that at any time. And after our panelists have a chance to share some details about what's going on, then Samantha Wexler in our offices will begin to take those questions and we'll go through them. And if we don't get to your question today, then we will try to get back to you and reply to you directly via email, but we do hope to get to as many questions as possible. So I'm going to start by welcoming each member of our panel today. And we'll start with Polly Dolan. So Polly Dolan is co-founder of both Nurturing Minds and the SEGA Girls School. And Polly lived and worked in Tanzania for nearly 20 years. And the past 11 of them, where she was primarily focused on helping to start the SEGA Girls School on that side of things. Prior to starting these organizations, she worked primarily for Care International in Tanzania and in East Africa. And before that, she did her undergraduate degree, her bachelor's degree at the University of Vermont, where just this past year in 2019, she received the Alumni Achievement Award. And she also holds a master's degree in international affairs from the School of International Training, which is also in Vermont. So welcome, Polly. Our second panelist today is Rukia Mchumo. Rukia is an advisor to Nurturing Minds. She's also grew up in Tanzania and did her primary and secondary education there before moving to the US to attend college. She received a bachelor's degree in chemistry from Lincoln University in Pennsylvania and went on to do her PhD in pharmaceutical sciences at Florida A&M University. Rukia currently works as a pharmacologist at the US Food and Drug Administration. And she also loves to help and inspire youngsters, especially girls. So welcome to Rukia. And our third panelist today is Dr. Vincent Orinda. He is a member of the Nurturing Minds and SEGA COVID-19 Task Force. He has vast international experience, having worked at the United Nations for over 17 years in Namibia, South Africa, New York, and Uganda. He was a senior health advisor for UNICEF in New York for many years, from 1996 to 2002. And prior to joining the United Nations, Dr. Orinda was a senior lecturer in pediatrics and child health at the University of Nairobi Medical School. In addition to holding a medical degree, he has a master's in medicine in pediatrics and did training in clinical epidemiology in Newcastle, Australia. So thank you so much to our distinguished panelists. And we will start with Polly Dolan, who will share a little bit about Tanzania and the context of what's going on there right now. Thank you, Polly.
Thanks a lot, Lauda. Thank you, everyone who's attending. Tanzania had its first COVID-19 diagnosis on March 16th, and they took immediate action. They had seen what was happening in the rest of the world and So the next day, all schools were closed and people were told not to gather in large groups. So about 6 weeks have passed since then. And now there's reportedly 480 official cases and 16 deaths. But it's like a good part of the world, it's very hard to know exactly what's going on because there's insufficient testing. So there's also a lot of fear among the population and mixed messages coming from all sides. So it's hard to know exactly how many people are affected. We do have our local network, and definitely there are people in the communities that are dying of breathing issues if they don't have tests. And currently the government has stopped people from attending funerals where somebody's been suspected to have died of the virus. So Tanzania obviously is a very different context than what we have here, and the president has not brought a lockdown. There are restrictions in place. A lot of businesses are closed, but for the most part, life is functioning as normal because they did not see the possibility of stopping people from doing their daily activities. They knew that it would possibly lead to hunger or other things. Nevertheless, they've been seriously impacted by the tourism, a complete halt for tourism. It's one of their top 3 GDP earners, and food prices are going up. With regard to SEGA, even before the first case was announced in Tanzania, the headmistress at the school was orienting the girls and giving them education about how to prevent it. So they had that knowledge. And then when we got the announcement that schools were closing, we quickly had some few last sessions with the girls and also with the girls clubs that we run, where our graduates are mentors to over 900 girls in the local communities. So we were able to get that education out. But since then, we've been taking a lot of other actions, which we'll talk about throughout the webinar. But that's just a brief summary of what's happening. And just to let you know that our students come from all over Tanzania. They're from about 14 different districts. So our response has been wide in trying to reach all of those people.
Thank you, Polly. Rukia will share a little bit about what our additional responses have been. Thank you.
Hello, everyone, and welcome to our webinar. And thank you so much for joining us, and thank you for your support. So to pick up from what Polly shared with you, that since the closure of schools in Tanzania, SEGA had to act quickly. And considering our students all reside in the school, since it's a boarding school, so we had to get the students back home. And as Polly shared, that our students come from various regions, and the distance can vary as far as 20 miles to 200 miles. So we had to arrange transportation to make sure the girls reach home safely. And so we didn't have enough time to put together probably any educational material or anything to send them home with. But immediate action was to get the girls back home safely. So after that, Nurturing Minds and SEGA also had to act quickly to come up and gather a team, a COVID-19 task force, as we named it. And this team consists of 14 members, and these members are experts in different fields, and our team also includes medical experts who are very crucial in the planning, strategizing, and implementing and gathering all this information. So we make sure we provide the correct information to our girls and their families and the communities that they live in. so we can help them in coping with this crisis, not only for their health, and also the team discussed other academic measures that we can help the girls with. So the team was gathered, and within a few weeks was able to come up with great ideas how we can get information to the girls. So, and also the team consists of SEGA teachers, and we have a SEGA team on the ground, and of course the Nurturing Minds team in the United States. So we meet every week, and together we were able to gather the important information, the short-term act first, including masks, the making of masks to send to the girls and their families, and also academic packets. And the academic packets to help the girls and keep them busy at home, and also to make sure there's continuation in their education. So there were, of course, a lot of challenges considering the girls are far, and also our teachers. At that time, the teachers had already returned home, and that some teachers do not live in Morogoro. So we had to ask the teachers to come back to SEGA, and some teachers traveled even as far as 750 miles from some other regions in Tanzania. But they were gracious enough and kind enough to return to SEGA, prepare educational materials for the students, and the whole team at SEGA was able to complete and compile the education packet, plus masks and soaps and sanitizers. And we also, with the help of our medical experts in the COVID task force, we were able to generate an COVID-19 information packet that is both in English and Swahili to help the girls and their families and their communities. So this information was distributed to the girls. And of course, transportation, the challenges in transportation, because it includes gathering the packets, sending them by bus, and then using motorcycle transportation individually to just go door to door to each girl's home and distribute them. Of course, the information also included how to properly use this information.
Thank you so much, Rukia. We'll turn to Dr. Orinda now, who will share a little bit more about emergency responsiveness and girls in crisis situations.
Thank you very much, Laura, and hello to everyone. Good afternoon. It has been a pleasure really working with the SEGA COVID-19 task force to try and do something for the girls, vulnerable girls in Tanzania. And I believe strongly that the lessons we are going to learn from this process will not only just be helpful for Tanzania, but will be also useful for other communities as well, and even other countries. As you very well would expect, staying at home is a good thing at this time of control for COVID-19. But at the same time, it brings its challenges. For example, the girls staying at home are very vulnerable in itself. Number one, they, apart from being at home and being exposed to all sorts of problems that may arise, that may even lead to unwanted pregnancies. Being at home in situations where they probably don't have enough food, so the possibility of trading sex for food would arise. Being at home idle and not having enough information would again predispose them to the possibilities of contracting the virus. So the COVID-19 SEGA task force, we came together and as Rukia said, we developed a very good information package that highlights exactly what happens, how the disease is spread, what they need to do to control the disease, how they should care for themselves and their families, how they can be change agents within their families, but also in their communities. And of course, we have emphasized the whole scenario of this social distancing, wearing face masks, making sure that they use hand sanitizers and they correctly wash their hands. But more importantly, we have emphasized how they can use masks correctly. And I think this has been very valuable. We have used very good information from CDC, from WHO, and from also Tanzania Ministry of Health itself to come together so that we can give the girls something that they can share. It is very important that the SEGA team, the teachers, are in constant touch with the girls. And in a way, it's like a helpline to them. They communicate to them regularly. And the girls also get support from the mentors. And we are very sure that these efforts will definitely make a contribution to their life skills and their well-being. We are very sure that the translation of the COVID-19 task force information on the virus, which has been translated in Swahili, is relevant to them. And the Swahili is very widely spoken in Tanzania, as it is in maybe other parts of East Africa. So this material will be very useful, not just for the girls, but for the families and communities as well. So in a nutshell, what we are saying is that this effort is very important insofar as protecting the vulnerable girls and their families and communities.
Thank you so much. So I see we have a couple of questions, but before we get to those, I wanted to ask Polly, what feedback are you getting from the girls and the staff specifically, and from the communities? What are you hearing? Some of their concerns are what's going on with them right now.
Well, we're checking in with the girls every week through the matrons, as Vincent said, and even the girls in the clubs, in the Modern Girl program, our mentors are checking in and our staff are checking in with the mentors. So quickly, we started learning things about the reality of our students on the ground, and we learned that 33 of them were only eating 1 meal per day, for example, and that helped us right away because we knew that we needed to send some extra support to them. We also understand, I mean, first of all, they were so grateful. The Form 2 and Form 4 girls especially were devastated to be sent home because they're in their national exam year. So when they got the packets through the community members that we sent, they were very, very happy, and especially to get masks and soap. And we had girls in the clubs asking for more supplies. So the school is now busy making more things. So we've been getting good feedback. Basically, people are very scared. They're very scared, and they know that they have to continue, but they just don't know what to expect. And it depends where you are in the country as well, but definitely urban centers like Dar es Salaam, Zanzibar, Morogoro, Arusha have all had a lot of cases, although perhaps not officially confirmed by tests, but just by the people saying they've been going to funerals. And other areas like Kigoma, they've only had 1 case. So it depends where you are, but people are scared. And I mentioned that food prices are rising. And a lot of our girls, it's important to know that they're from rural areas where they're already very underserved areas. So their basic amenities might not even be there, such as electricity, often no running water, poor quality of health facilities and education. So this new pandemic, on top of something, for example, they've had 6 months of rain, very unseasonable rain, which has affected the harvest and their normal farming. So when we get a new issue on top of that, it just exacerbates all of the regular hardships that they already have. So life is getting tougher.
Thank you. So Sam, why don't we take a couple of the questions that have been posted, and then I'll turn back to some more questions I have.
Sure. The first question we have is about the situation with food availability. Polly, you just touched on that a bit in your last point. I don't know if there's anything else you'd like to add about that. Or anyone else.
It's something we're keeping a very close eye on, because one of the benefits of having this global task force is that the pandemic has reached here before there. So we're already learning from our own situation. And it's been helpful all the way along. We've been able to give a heads up to SEGA to say, this is what you might expect next. And certainly food insecurity is the thing that we're expecting next. And we've seen it in the neighboring countries, Uganda and Kenya. There's a lot of social unrest in some areas. The governments are responding, but we can look at the neighboring countries and see the trend. And knowing that tourism is one of the top 3 income earners for the country of Tanzania, the next natural impact will be food insecurity. So we're monitoring that very closely.
And I also wanted to add to that even in our packet, as Polly said initially, we already identified about 33 students who are already having difficulties with even having 1 meal a day. So in the packets for those students, we included money to help with food for those families. And as we continue to monitor the situation, we will continue to also see what we can assist with in terms of the food for all our students and their families.
I think it's also good to add that in the immediate term, the problem of being away from school, controlling or preventing coronavirus is the focus. But in the intermediate time, in the medium to long term perspective, obviously food is going to be a major problem, not only for the girls, but even the communities that they live in, particularly given that this is a time for planting. In Kenya it is, I believe in Tanzania as well. So when people are not able to do planting and to cultivate their land, and they're not able to really grow food, one can see that number one, food prices are going to be higher and higher as food gets more scarce. And in the medium to longer term perspective, food is going to be a major problem, not just for the girls, but for their families and their communities.
Thank you, everyone. The next question is whether the girls were able to take all of their personal items home with them. Did they think that they'd be coming back to get things?
They did take everything with them. It's our normal procedure when they go home for their breaks. They don't come with a lot of things, and they did go with them, although they knew when they were first told schools were closed, it was supposed to be for only 1 month. But since then, it's been extended to indefinite.
Thank you. Next, we have a couple questions about the possibility of schools reopening. Thelma says, it sounds as if the girls' presence in their communities is helpful for the communities, but I can't help wondering whether the girls would be safer in the school than back at home. Is this true? If so, is there any possibility of allowing them to come back? And to follow up to that, Angela asks whether there are any indications as to what the Tanzanian government needs to see occur before they open up the schools.
Before the government handed down the decision to close schools, the SEGA board had met and the teachers had all met separately, and both bodies had independently decided that we should allow the girls to stay. But because they felt also that they might be safer at the school. However, we aren't allowed to we have to follow exactly what the government tells us to do. So the next day, the government announced that all schools, including private schools, needed to close and all students should go. There is no clear set of indicators or criteria for what would be in place in order for schools to open. And again, there are rumors There's rumors that they'll open soon. There's another rumor that all of the East African countries have met and decided they're staying closed until September, but we don't know if Tanzania is also following that. So we really don't know.
In many ways, school is a safe environment, but given that with regard to COVID-19, if the virus is introduced in the school and there's not enough social distancing, and people are not disciplined enough in use of masks and the other preventive measures, that it may not be safe. And in fact, that is why everywhere schools have been closed. And as a matter of policy, it will be difficult to keep one school open and the others are closed.
Thank you. Go ahead, Rukia.
Okay, now I just wanted to also point out that as Polly and Lauda, and we've already mentioned earlier, that we try to keep in touch with the girls every week. The matrons call to make sure the girls are okay. And we're also, I think, as a task force, for the next wave, we are discussing and also planning ways that we can provide life skill information, because remember, SEGA provides holistic education to these girls. So they're already been taught about life skills, you know, about respecting themselves, how to defend themselves in case of anything, any adversity that they face, or if they feel, you know, unsafe, you know, in any environment. So of course, staying home might be a challenge, and for them, because most of the time they spend in school, you know, almost, I think the holidays is also maybe 1 month or, you know, 2 months a year or so they spend at home. So, but at the same time, so we are planning to at least assist them and also provide with information reminding them of the life skills or the education they get at school and how it can help them stay at home and also cope during this difficult time.
Thank you. Another follow-up to this is whether anyone is currently at the school.
Does someone else want to answer?
Sure, I can ask it. Yes, of course, we have the headmistress or principal of SEGA school who lives there, and we also have the watchmen or security guards that also help make sure everything is safe, the campus is okay, and I think maybe a couple of teachers. And of course, for the period when we were preparing this packet, we had, you know, as I say, we had to act quickly. So I think we acquired maybe 1 or 2 people who helped to make the masks. They were there. But as far as the schools, the headmistress and the security guards are there to make sure everything is okay.
And I think there's also a matron that is there as well, as she lives there full time with her family normally. So, yeah.
Thank you. Dr. Carl Mahina asks, do any of the girls have special healthcare needs? If so, are there ways of ensuring they have access to health services and supplies during this time?
There are students that have medications and healthcare needs that normally get attended to by our nurses on campus. And now that they're at home, they're most likely getting attended by the local clinics that they were using before they came to SEGA. The only thing we're doing in that regard is just keeping in touch with all of the girls and finding out if there's specific needs that are urgent. We expect to hear about it and be able to support.
In general, on the ground, people are afraid to go to health facilities. I was talking today to a hospital on the other side of the border in Kenya, and they told me that the visits to the hospital has gone down dramatically, and bed occupancy in that hospital has gone down from 80% to 20%. So I'd imagine that even in this case in Tanzania, people are afraid to go to the hospital for normal, checks, or if they are sick from malaria or other things. So there is another risk that is there, that what would normally be treated in facilities, there will be a delay, first of all, in seeking care, and 2, they may not have the correct medication in time. So chances are that the girls probably would be sick and not seek care. So perhaps this is another area of education that we need to step up and let them know that when they are sick, they really need to seek care.
Or maybe these are specific questions we need to add to we have a very small list of questions that we ask when we make these calls, but I think it's a good point. We could be identifying those girls and find out how are they faring now.
Thank you. The next question is whether you're worried that students might not come back to school.
Definitely, it's always a worry for girls, especially because we learned the lessons from the Ebola epidemic in Sierra Leone, Liberia, that pregnancy among adolescent girls went up by 65%, and many did not return. So in SEGA's case, we of course are doing everything we can with regard to calling them, providing that moral support, reminding them of their goals, the life skills that we provide. I'd say they're in a much better position starting off than the general population of schoolgirls in Tanzania, because they've received so much in the way of life skills and thinking about their lives proactively. What do they want to do? What are the pitfalls to avoid? What are their rights? And so forth. But of course, we're still concerned that that could happen in some cases.
Thank you, Polly. The next couple questions we have are regarding Nurturing Minds and SEGA's plans for the future, both near term and a bit longer term. So we have one question about what is the next focus for the COVID-19 task force, and how will Nurturing Minds keep Symporters informed of how we can help?
Lauda, do you want, or if you want me to answer, I can. We haven't heard from you.
I can answer it, sure. I wasn't sure if somebody else was going to jump in. So yeah, actually, it really relates very much to the previous question about girls not returning because of this data from other crises that have gone on. We are very nervous about that. We're nervous a bit about the girls' mental health, but also about them not keeping hope. So maybe, falling prey to early marriage and early pregnancy, which are some of the biggest things that challenges in their lives prior to coming to SEGA. But with the very robust life skills program we have, generally we have, once the girls are at SEGA and in school, they see the options before them, and as long as they're staying in school, they're able to avoid some of those large pitfalls. So our next step really is that we've been working closely now with our counselors and our Education for Life team. So we have 2 lead counselors who now are going to begin to phone the girls and spend some time speaking to all of the 260 girls. Previously, the weekly check-ins have been through our matrons and our nurses, but not specifically with our counseling staff. So that is the next step that is happening. And they're also sharing their phone numbers as sort of a hotline in case of emergencies, that they can reach out to their counselors directly. Right now, a lot of them, if they are having issues, are reaching out to our headmistress already, so they do have that. They know they can call if it doesn't happen to be one of the weekly check-ins. And then the next step is beyond that, in terms of our Education for Life, is that they're going to create some literature that they're going to share to reinforce that And that will be shared when at the end of May, because they received those educational packets that went out, and some of them live quite distantly from the school, where it required, 7 hours drive plus a motorcycle ride, for example. So when they pick up those packets, they'll drop off the Education for Life, life skills packets, kind of reminding them of a lot of the things that they learned in school. So that's one of the next steps. And we're also immediately starting this week, they're going to begin to make more masks. And that is, each of the girls, as Rukia had indicated, got 3 masks who go to SEGA, but we also work with 900 girls in 20 communities through our Modern Girl Outreach program. So those girls have already been receiving liquid hand soap and also the COVID-19 information packets this past week, but they didn't receive the masks yet. And so we know they don't have access to the masks right now. So we're going to begin the process of making masks. So we just spoke to our headmistress this morning, and we're going to begin the process of making masks for all of those girls in the communities right away and distributing those. So that's kind of the next thing on the horizon. And then longer term, we are looking more at what are the possibilities for remote learning if the school remains closed for an extended period of time. So I'll let maybe somebody else address that, but we are, if the school, so normally June is a break for Tanzania. So right now, that's why the information, the education packets they received kind of bring them up through the end of May. And then they would normally be out of school anyway, although SEGA and Nurturing Minds, we do additional programming in entrepreneurship and leadership during that break time. They stay on our campus. So they won't be doing that this year, but we want to be prepared for July. July comes and if they don't go back to school, we're looking at other remote learning possibilities. So maybe somebody else on the panel can address that a little bit further.
Well, I just wanted to say that the task force has identified 4 priorities. And priority number 1 is protecting the girls and their families and other community members. So getting masks, protective masks, is very, very key and very important. Right now we're giving 3 per student, but we might expand that. And therefore the need for more masks is very inevitable. Secondly is the use of soap and sanitizers and hand washing and hygiene. We're looking at not just the 260 girls, but the 900 girls in the program. And we are looking at least 3 months supply. And obviously that is an area that we may expand as well. The third priority is the education packets. As Laura said, for now, we are not looking at a distant learning in terms of technology, but that will probably most likely come because the use of smartphones and tablets is going to be inevitable, especially if the girls stay longer than is expected. And the 4th priority area is the area of food and medicines. And again, we can't say exactly what will be needed right now, but in the coming weeks or so, one will be very clear in terms of what are the needs of the families and the communities around them, because you can't feed one family and the next family is hungry. So food is going to be a major area. And then, of course, how do we learn from all this? How do we expand the knowledge and the experience to other schools, to the neighboring communities, even to the neighboring countries? So we stand a good chance of expanding the use of the experiences gained to benefit other communities, to benefit other schools, and to benefit even the East African region. So in this case, we feel very strong that we have a major role to play, and that is why we really have to go all out to do everything possible to mobilize resources and to build capacity to be able to deliver whatever we are promising to the girls and the communities.
Yeah, I could also add on to that about the distance learning. We're fortunate that there is one or two, there are two and a third coming, at least that we know of education platforms oriented towards secondary students in Tanzania, whereby the entire national curriculum is available on mobile devices. So we're in the stages now of looking at what are the best type of mobile devices, and how would we get our teachers trained up, but to get those out to the girls so that they can access some supplementary materials online, even as they're getting their education packets. Of course, there's a lot of factors to consider, such as electricity, how will they charge them, etc. We're looking into all of that now.
A follow-up question to that is whether the educational packets are being specifically made for SEGA girls, or are the packets being made available for all people in the home?
Well, there's two types of educational packets. One was the academic packets that our teachers were preparing for the girls, and those were 25 to 30 pages long regarding their different subjects, and it depended on what form they're in, especially for those in the national exam year. Everything is focused right now on preparing for that national exam. And of course, any family members can access those, but they're primarily oriented towards the girls. Whereas the COVID-19 education sheets that we also put together are really for the girls to be able to have a sound, true source of information so that they can share with others as well as keep themselves and their family safe.
Thanks, Polly. We have a couple questions now in regards to communication. So one person asks whether the girls are able to communicate with each other and offer each other support during this time, in addition to the support that they're receiving from Nurturing Minds and SEGA. Additionally, we have a question about whether people can write to the girls while they're at home from the US.
Some of the girls definitely have contact with each other. It will very much depend on their phone status. If they have access to a phone, everybody has some kind of access to a phone, whether it's through a relative or a neighbor. Often girls or people that can't afford their own phone, they'll keep a SIM card and they can borrow their neighbor's phone to put the SIM card in. So definitely there is informal access. We have not created any mechanism yet for the girls to facilitate their communication to each other. We've so far just been focused on ourselves and the girls, but it's not a bad idea. And I mean, in the clubs, with that scenario, that's a bit different. We have been directly facilitating the mentors to the girls in the clubs, but we have not yet. And what was the second part of the question?
I think it was about communicating with the girls. So as many of you may know, we do have a student sponsorship program. And so our sponsors do write, and we have pen pals too that write to the students. And I'm not sure how well the mail is doing right now in Tanzania, but we do have an email that goes generally to the school, and then the letters can be printed out and they can actually be sent with the next round of packets. So if you're connected with a student, we definitely encourage you to write. We think that this will be really a positive for their mental health and just bring up their spirits to receive communications from supporters. Yeah.
Thank you. In returning to the question of distance learning, there is a question about whether the girls will have sufficient internet access in rural communities in order to access the online learning portals.
Definitely, that's a huge question, and those are among the things that we're investigating. We did learn that a local phone provider, I believe it is Vodacom, has created a partnership with Schule Direct, which is one of the platforms that's available. and that they will provide free airtime or free, able to use your phone for free if you're accessing that educational platform. So it means you would get it through your phone, and rather than having to pay for it, even if there will not be any Wi-Fi around for sure, but if they have their SIM card in the phone, that they should be able to access it. There are some communities that are so remote that you can't get cell phone access, but generally cell phone access is available in most all over Tanzania well before it was here. They've had their cell phone technology up and running.
Thank you. Could you talk about the Modern Girl Soap Making Initiative?
Sure. Before the COVID-19 pandemic arose, it's a product that the girls were learning how to make, and they make liquid soap. And what we did in this case, to respond to COVID-19, we thought first, should we buy soap and send it to them? Should we send them money to buy soap? Should we have the girls make soap? What should we do? In the end, we found the most efficient way was to buy the materials for the liquid soap making, and for our mentors, we have 38 of them, to make the soap for their clubs, supervised by our staff. So that was the direction we took. And they were handing that soap out. They've handed it out already in many of the communities, and that is continuing throughout this week.
And Polly, can I add on to that question, and just can you explain a little bit about how the Modern Girl program might help support the larger community as a whole?
Sure. I think we have a really good opportunity here because we have 8 field staff, 38 mentors, and 20 clubs with 900 girls being touched by these clubs, engaged in these clubs. The clubs meet normally, before the pandemic, they were meeting twice a week, and they're learning communication skills, rights, everything in our Education for Life program, as well as financial literacy. And there's been a high demand for business and entrepreneurship skills, hence the soap making. But we have this network that extends deep into rural areas, and the girls know each other. They have been provided the same information, so they're a step ahead. They know their rights, they know how to plan, they know what to expect. So I think that we do have a really good opportunity to harness and leverage this network to help the girls be leaders to their families and communities. As we're passing out this information, they can also become sources where people can turn to.
Thanks. We have a question about the relationship between Nurturing Minds and SEGA and the SEGA graduates. What has been found out about this group during this time of crisis? And also there's a question of whether this group might be able to help tutor current SEGA students in their area.
Yes. We have graduates that are being supported with scholarships to other colleges and institutions right now. These are advanced level institutions or diplomas or universities. And then we have alumni who have already completed those programs. So we've got a lot of graduates out there. And we have a WhatsApp group whereby daily communication takes place for anyone who happens to message the post form 4 counselor. That's what we call her. So there is ongoing communication with them. All of the colleges and institutions are closed, and that's also affecting the girls, just like our girls who are in their Form 4 year, many of the ones in the colleges are in their Form 6 year. They were supposed to be taking exams. So they're really in a bind as well. And the idea is very interesting for remote tutoring. I suppose it would have to be remote of some kind. But thank you for the idea. We hadn't thought of it.
Thank you. There is a question about when letters would need to be sent via email in order to ensure they can get added to the next packets.
Oh, go ahead. Sorry.
No, I was going to say that I think that at the moment that would be the best way to do it, because we're not sure about the mailing service in Tanzania, and especially it always takes longer anyway for mail from here, from the US to Tanzania. So I think emailing and then printing at school will be the best way for the letters to be delivered.
And I think if the letters are received in the next 2 weeks, it would be best, because it will be, I think, around May 25th and the end of May that they've given the deadline to the girls that the packets, packets they received, the education packets will be retrieved. And so that's the time when they would be bringing this new information and when letters could be delivered.
Thank you. So we have a couple questions now related to the financial situation of SEGA and how people can support Nurturing Minds and SEGA going forward into the future. So the first question is, how is SEGA coping financially right now?
So thank you for that. So right now, thanks to the extreme generosity of our supporters, SEGA is coping fine. Nurturing Minds and SEGA is doing fine. I actually was going to give an update on our emergency fund at the end of this, but we're approaching the end. And I want to say thank you. I know a lot of people on this webinar right now have already contributed, but we have raised already a little over $32,000 in the last week through our emergency fund that we've created. So that is fantastic. If we, in trying to look into the future at all of these different things, from remote learning to food insecurity that we may need to respond to, that could be over $120,000 or $130,000. So we do hope to continue to increase the size of this fund while, we are in a good state right now, and we can and intend to continue to support this outreach, but also to support our teachers. We are very committed to supporting our staff, which we feel has, we're in an excellent place with our staff right now. Our girls have done so well, as many of you know, on their national exams in the last years, and especially this past year. And so we want to ensure that we still have quality staff when we come out of this, but also as most likely there's not going to be any emergency fund through the Tanzanian government necessarily. No, paycheck relief or unemployment relief to go to. We want to make sure that we can continue to support our teachers and look to them for for guidance. But in any case, so as many of you know, today is the special Giving Tuesday now for COVID relief. And so if you haven't had a chance to participate, we would love anything that you could do to support us so we can continue to respond to the crisis as things progress.
Thank you. Going off of that, Annie asks, can you speak to what you hope will be the outcome of this special Giving Tuesday?
So we hope that, we can potentially raise another $5,000 or $10,000 through this special day. But, we'll see how things go. Yeah, people have been very generous so far. So we're very happy.
Thank you. We also have a question about whether we've been using financial reserves in dealing with this crisis.
Thank you. So we have not had to turn to our reserves at this point in time. And we, of course, since the school is closed, there are some cost savings for the fact that we don't have girls on campus eating, for example. So while other costs remain constant, that's one savings area. We actually start our next fiscal year, not to get into the weeds too much, in July, and normally we just plan one budget, but we've actually planned 4 separate budget scenarios with the understanding that things may, if funding does dry up or begin to decrease significantly, as we know that Americans, who are the majority of our funders, are also suffering right now, and may not be able to continue to support us long term, that we may have to cut programs in different areas, and that we will follow different action plans in our budget depending on how much money we're able to raise. We do have reserves right now that could carry us through, and we hope not to tap into those reserves for quite some time, but we are committed to tapping into those reserves before we would, for example, begin to cut our teacher salaries. If that fully answers the question.
Thanks, Lauda. We also have a question about looking forward. Do we think that the English fluency program will be going ahead in the fall?
It's hard to look into a crystal ball, but of course, I really hope that we can all, that borders reopen, and I think it will be very much dependent on the access to testing and to any kind of vaccine, which I don't think it really could come as soon as this fall. So I think, oh, sorry?
Flights.
And flights, and right, the availability of international flights. There's so much that's unknown. But one thing I did want to say to everybody is that we hope to host these webinars at least once a month for the coming few months. And so we will definitely be keeping people as up to date as possible. We know the situation is very fluid, things are changing quickly. And so we will definitely keep in touch with all of you and let you know. And I think that we'll probably have to make a decision by July or August as to whether or not that will happen.
Great. And I think we're going to head to our last question here before we start wrapping up. But if anyone has any other questions, please feel free to reach out and be in contact with us. We are always available. So Lauda, the last question that we have is, how can others offer Nurturing Minds and SEGA support now and in the future?
Well, first I want to say, I know it's coming up on the hour, thank you all so much for joining. And as I mentioned, we're so grateful for all of your ongoing support during the year normally. And of course, we're especially grateful for anything that you can do right now. So I would say financial support is probably the #1 thing that we need so that we can have the flexibility to be responsive to the crisis as things come up. So that's probably the #1 thing that people can do. But please, share your ideas. You can email me or reach out to any of us at any time. And if you have ideas like some of the things that came up today that we haven't thought of, we would love for you to do that. So we're very open. And if you have an expertise in any of these areas that we mentioned, please feel free to share that with us and email me anytime. Yeah. I don't know if anybody else has anybody from the panel has any last parting words before we close out for today.
I just wanted to thank everyone for joining us, and thank you for your continued support. We know that you've been supporting Nurturing Minds and SEGA all this time, and I know now we need your support more than ever, but we thank you for joining, and just know that we are working hard, and the COVID task force that has been created is gathering information and looking to best ways to help the girls, their families, and their community at large. So we're not just trying to end, and we're hoping that the information we gather and share with the girls can also be shared, even as we said earlier, in other schools in Tanzania or even in East Africa. So thank you so much.
Yes, thank you so much, everyone.
Thank you.
Thank you, everybody. So we hope to see you again and a future webinar. And thank you again for your support.